I see it in my office all the time. They are bothered by lines, by sagging skin, by the changes that occur. They may not talk about it openly to their circle of friends, but they're coming in and talking about it to me. And so doing these procedures, yes, it's helping the cosmetic appearance, but it's also
So, Sanji, guess what?
What?
You know, you've been kind of questioning injectables and wanting to know a little bit more about it.
Yeah, I'm super curious.
Well, I have found someone for us to talk to. So I cannot wait to really dig in and start asking the questions that, you've been wanting to know, because this is something that we've discussed for since we started the podcast, wanting to know more about injectables. So I am so happy I finally found her, and it took a month, but we've got her on the show.
Oh, that's so excellent. I'm so excited because, yes, as we in our midlife start to age and things start to fall down, wrinkle up. No, I've got tons of questions because this is something that I'd like to do. I'm not one of those people who's ashamed or one of those people who's like scared to tell anyone. So I'm telling everyone, yeah, I'm interested. I want to know what I can do to look a little bit more youthful. So I'm excited. So let's bring her on.
Yes. Yes. We have a special guest with us, and we've been talking about this for a while, and now we finally have her with us. We have Dr. Jacinta Anyaoku. She is the owner of Hibiscus Aesthetics and Wellness in Katy, Texas, which is not far from me. So we're excited to get to know her and her practice, and also just kind of talk about injectables. That's something that we feel like is trending lately. So, Dr. Anyoku, tell us about yourself a little bit. Tell us about your business.
Yeah, thank you for having me. As you said, I'm Dr. Jacinta Anyaoku. I am a board certified family medicine as well as obesity medicine physician. And I started Hibiscus Aesthetics and Wellness in 2021, end of 2021. We're here in Katy. And originally, the goal of my practice was to be an alternative for primary care. It started off doing direct primary care, which is a different model. We don't accept insurance. Patients pay a monthly membership fee. So it just cuts out the traditional barriers to care that you might see with a typical practice, such as long wait times and hard, takes a while to get in to see your doctor, burnout with the physicians. So direct primary care solves a lot of those things. I've also really loved derm aesthetics. That was one of my passions as when I went into medical school. And I ultimately chose family medicine over dermatology just because I realized that I could incorporate a lot of dermatology into a family medicine practice. And I also felt like I loved treating the entire patient. I love being able to do the primary care as well. So when I decided to open my practice, I knew that I was going to incorporate aesthetics. And, I finally had a chance to have my practice the way I wanted it to be. So about 2 years ago, I started doing more aesthetics procedures in the practice, slowly adding things in. And then now it's really grown to the point where it's more of an aesthetics practice than a primary care practice. And I'm happy to talk about all the procedures and things that we're doing. It's really exciting, all the new things that are out there.
That sounds really, really cool. I just love hearing that because there's definitely a market for it. I know that for me personally, I work with two different telehealth companies, one telehealth for my um, hormone replacement therapy,
Mhm.
and then another one because I'm on terzepatide. So, and yeah, they don't take insurance. So I completely understand. So I'm really happy to hear that you are board certified, not only in the family medicine, but also in the obesity medicine to help
Mhm.
those, like you said, the
Yeah,
whole body, not just, one area. So that's
right.
great. So tell us about some of the, things that you offer specifically with the injectables. Like if I'm
Hmm.
brand new, I have no idea like where does one begin? If you're someone
Hmm.
who's like me, I'm 59 years old and I want to do a little bit of something. Where do you begin? Like what do you
Okay.
offer?
Right, right. Well, we offer the typical things. So Botox is going to be the most common thing that people are going to get done. So we're definitely doing that. We do fillers. We also do something called PRF, Easy Gel, which I'll talk about more in, a little bit later. Kybella, which is some fat dissolving injections. So those are going to be the main injectables. Now, a lot of people don't necessarily know the difference between Botox and filler. I get that question a lot. And so the difference is really what are you trying to target? So, a new patient coming in, actually, the first step is going to be just sitting down and discussing what are your concerns? What are the things that you don't like, that you want to change or you want to improve? And then that's going to help us figure out what's going to be the best injectable for you.
Okay, so somebody like me, so I'm wearing a lot of makeup, so you can't really see,
Huh?
but my particular I'm like my under eye area, I'm not happy
Yeah.
at all, and then
Okay.
jowls. So like
Yes.
I feel like I
Yes.
have to kind of always maintain a smile because otherwise
Uh-huh.
everything kind of goes this way. So
Gets down and
so
droopy.
for someone like
Yeah.
me, what's what?
Okay. So let's talk about Botox first. And I'm using the term Botox, but Botox is just a brand. So the general term is neurotoxin. You might hear people say tox or toxin or neurotoxin. So that's the actual ingredient. Neuromodulator is another term that we use. And there are different brands. So Botox is one, Dysport is another popular one. Xeomin, Jeuveau, several of them out there. Most of them are similar. The main differences you're going to see are things like how quickly the onset of duration and how long it lasts. Those are going to be the main differences. The thing that these neurotoxins are doing are relaxing muscles. So if you have a concern of fine lines, wrinkles, typically we're going to see that in your forehead area. So if you like raise your eyebrows up, you might see some lines forming in the upper forehead, or if you squeeze, you see these lines here. Those are probably the most common areas we target. Smile lines, we call the crow's feet. Um, with filler, the issue with filler is you're using it for areas where you have lost volume. So as you get older, you start to lose hyaluronic acid, collagen, and you're going to lose that in your cheeks, under eyes, lips, around your mouth. And so that's when you start to notice sagging. So you mentioned jowls. That's this area here, and everything just drops down and starts to sag. So filler is really going to be the treatment for that. We do filler for the lines around your nose and mouth. We call that nasolabial fold. Marionette lines are the ones a little bit lower here. Filler, of course, in your lips. We do filler in your chin and your jawline, and that really helps with the jowl issue. And we also do cheek filler. So it's actually recommended if your concern is jowls, lines around your mouth here, really recommended to start with cheek filler because the cheek filler is going to give you a lift. You see how if I push up here, it kind of lifts things a little bit. So you put it, we go down to the bone. It's almost like we're putting an anchor and we're, putting a good base. And then you start to see some lift. You might still need filler in the other areas like here and your jaw and your chin, but you always want to really start with the cheeks. With the Botox, like I was saying, common areas is going to be the forehead, around the eyes. There's some other places that we do it too that are not as common. We can do it in the mouth area. You can help with something some people get a downturned mouth. As you get older, you tend to do this a lot. Your mouth just kind of curves down. We can put some Botox in the corners and the muscle right here to prevent that from happening. Filler can also be put in that area, and that can help with giving your mouth a little bit of a lift. With Botox, you want to remember that we're focused on injecting a muscle. So what it's actually doing is preventing that muscle from contracting. So when that muscle is not contracting, then you don't get movement in that area. When you don't get movement, then you're not forming those lines and those wrinkles. So you can start it early. You can start it in your 20s. You can start it in your 30s. And when you do that, you might not need as much, but it's considered preventive because you put a little bit, you're reducing that motion. You still have some motion. So like I do it on myself. And once we're done, I'm getting ready to do my next session. I haven't done it it's been over 6 months. So I probably do mine twice a year. But, now you see I have pretty good movement. When I do it, I still have movement of my eyebrows, but you don't see those little lines as much when my treatment has kicked in. So over time of doing that, you're going to prevent those lines from becoming etched in, deep, permanent. So that's the reason to start early. And when you're older and you do it, sometimes those lines are already deep and there's just no way to fully get rid of them. So you'll get some good results. Things will look smoother, but you might still have a little bit of lines depending on when you get started. So somebody who is totally brand new to injectables, I think a good place to start is with a neurotoxin. Um, Another difference between the toxin and the fillers is that neurotoxin wears off quicker. So on average, it's going to last about 3 to 4 months. Filler can last anywhere, depending on the type we use, anywhere from 6 months to 2 years or more. And, it depends on the type of filler we're using, where it's being injected. So if you're just not quite sure, let's say for lips, for example, as you get older, you're losing volume in your lips. Your lips they'll start to look thinner. You just may not see as much definition. There's a procedure we can do called a lip flip. So a lip flip is when we inject toxin along the muscles on the top of your lip, and that can relax those muscles to allow a little bit more of your lip to show. And when a little bit more of your lip shows, and that can give the appearance of a little bit of a fuller lip, but it's not adding volume or anything like that. So it's very subtle, but it can give you enough of a change that you can get a little bit of an enhancement. It's temporary, will wear off in maybe 2 months or so, 2 to 3 months, and then you're back to your baseline. Versus filler, we're actually injecting hyaluronic acid, and it will make the lips look fuller. And that can last you for 6 months to a year. It's going to be average with lip filler. Another popular thing, and I think you had mentioned your eye area is a
Yeah,
concern.
the under eye area is just like
Yes.
it's just not as tight as it I want, and so
Yes.
I have to use concealer to just kind
Okay.
of cover up the
Yeah.
showing of my age.
Yeah. So that under eye area can be treated a few ways. So one way is, again, traditional filler, hyaluronic acid, inject it into the under eye area. We call it the under eye hollows, and, we put filler there. Another thing is putting a little bit of neurotoxin, and it can help relax those muscles so you're not seeing the fine lines as much. A third treatment, which in my opinion is the best one, and it's my favorite one to do in the under eye area, is PRF Easy Gel. So with PRF Easy Gel, we draw your blood and we isolate from your own blood sample growth factors that trigger collagen, regeneration of your skin, and it also is adding volume. So it's doing two things. It's helping the condition of your skin, but also helping to fill out that hollowness that's noted under the eyes. It's also considered very safe. So with a traditional filler, there are some risks, and especially in the under eye area, there are some risks. If it gets injected, in the wrong location, and that filler gets into a blood vessel and migrates to where it's not supposed to be, that could lead to some pretty serious complications. With PRF Easy Gel, we really don't have that risk. It's purely your blood, your own blood sample. So there's no risk of your body rejecting it or forming nodules or having some sort of reaction. It's all natural. So definitely one of my favorite treatments to do.
Real quick, you've used the word toxin a few times. So just to
Yeah.
get rid of everyone's fears, toxin is not toxic, right?
No,
Okay,
it's
so
not. That's just a short form. So the full thing is neurotoxin and that's just the name for Botox, Dysport, Xeomin. Those are all brand names of a product called neurotoxin. And what they are is botulinum toxin, which, yes, we have heard people get scared. You think of botulism and things like that, but it's not the same strain that's going to poison you or make you sick or cause any sort of problems. So it's just a different strain that is made for medical use. hmm So you might hear me say toxin because it's just quick and easy to say, but it's not anything toxic.
absolutely. I just wanted to clear that up so that folks didn't feel like it was,
Right,
toxic.
right. Yeah, yeah. hmm
I was
Yeah,
actually surprised to hear you say to start preventive care in your 20s. I would think
yeah.
it's too young, they shouldn't have to worry about anything like that. But just, hearing you say just doing a little bit,
hmm
that's just
hmm
something I wouldn't have thought of.
hmm Yeah. A lot of people may not think about that, but I would say that the times are different. So, as you probably know, th- the girls these days, they are very into skincare and very into all of this stuff, starting as young as age 10. They're buying products and all kinds of things. And I mean, do I support that? No. However, with these injections, it is considered it's safe. So I'm not going to inject anybody under the age of 18, so nobody who is not legally an adult. And I also tend to be a very natural and conservative injector. Every person who's doing injections has their own philosophy. My philosophy is less is more. We're going to do the least amount of possible to give you the results that you're looking for. But yeah, we do have young people coming in and asking for it. Their friends are doing it, they're seeing it on social media, and they want to do it too. And so when young people are coming in and they may not necessarily have the lines and the wrinkles already, we call it baby tox. That's another name for it, or preventive toxin. And the whole point is that, you put in just little amounts, and again, that's going to prevent those muscles from going into those motions that will form those lines in the first place. And one way to look at it is, doing a little bit early on to prevent can actually save you a lot of money and complicated, more invasive procedures down the line. So not everybody is a candidate for these things. Not everybody even is bothered by their lines. So it's really for people who that's just something that is important to them. They don't like lines and wrinkles on their face and they don't want that. So if they already have that mindset and they are into those types of treatments, then this is a way that they can do a little bit early on to try to prevent having um, more invasive procedures down the line, if that makes sense.
Yeah,
I like
absolutely.
that.
hmm
It's just like when you're going to your primary care doctor or a specialist and they're telling you to do certain
hmm
things,
hmm
early on to prevent something
Yeah,
further down the line. This
right.
makes sense when you hear it like that.
Yes, yes. And I think also people think of injections and all of these cosmetic procedures as it's vain, it's not necessary, why are you doing this? And even, in our communities, Black women, we don't need this. Our skin doesn't do that, but a lot of people are actually bothered. I see it in my office all the time. They are bothered by lines, by sagging skin, by the changes that occur. They may not talk about it openly to their circle of friends, but they're coming in and talking about it to me. And so doing these procedures, yes, it's helping the cosmetic appearance, but it's also even helping, it's playing a role in mental health. You know, the way you look and feel on the outside really does have an effect on how you're feeling on the inside, and it helps your self-esteem, helps your confidence. And there's nothing wrong with that. So that's one thing that I think doesn't get said enough, is that it's okay to want to get Botox. It's okay to want to enhance your appearance with filler. There's nothing wrong with that. You know, if that's what makes you feel comfortable and confident, then so be it. And there's nothing wrong with it.
Yeah, I'm glad you mentioned that because, see, that seems to be one of the biggest concerns is that, like you said, people aren't talking about it with their friends
Mm-hmm.
and their family because there's a stigma attached to
Mm-hmm.
it. You know,
Mm-hmm.
oh, so and so went and got some work done, or,
Yes.
but like, so what? Like you said, if they want to feel better about themselves because if you don't look good, you don't feel good.
Mm-hmm.
So, like, what can we do to overcome that stigma?
Mm-hmm. Talk about it. That's going to be the biggest thing. You know, if you are getting things done, let your friends know. Like, I just let them know. I did this. I went to this doctor. I tried Botox. I tried filler, and I loved it. You know, if you loved your results, I think that's really the first step, is just simply talking about it. And people just don't do that. You know, I here in the office, part of our, we have patients sign consent forms, and they give permission. They have to give permission before we use any like pictures or imaging for marketing and things like that. Majority of people say no because they don't want anybody to know that they did it, or they might agree, but they don't want to be identifiable. So there's still a very, it's very prevalent that people are just not fully comfortable with it. I do see, though, that younger patients that are coming in do tend to be more comfortable, and a lot of them are totally fine. And I think that's because it is more accepted in the younger generation now. So it's not a big deal for them. But for those of us who are a little bit older, it's still kind of a quiet secret. So I think the way to get out of that is really just open up about it and share. You know, and if it's somebody who has a wide audience, be it social media or, some other platform, share it on there. Share your journey, share your experience so people can see what it's like and kind of maybe get past that fear, because I think fear is a big part of it too. People are scared to get injections. They're scared of potential pain. They don't know. They don't know what the experience is going to be like. So sharing as much as possible, I think, would help.
So then with the pain and the fear, so walk us through the process. If
Mhm.
someone says, okay, I'm going to go for it. I don't care what people think. This is what I want to do, but I'm
Yeah.
just like afraid. Like, so what type, like, do you use a cannula? What type of needles? Is it painful? You're going to walk out with your face
Mhm.
swollen? Like what, what,
Mhm.
what can people expect, like step by step?
Okay. So let's start with Botox, neurotoxin. With a Botox appointment, we are using little needles that are actually insulin needles, like the same needles that people use to inject insulin, or the same needles people are using to inject the weight loss medication, semaglutide, tirzepatide. It's the exact same needle. So a lot of people have been doing those lately, so they know what that needle is like
That
and
you
what it
feel
feels like.
nothing. I tell people I inject every week. I
Yeah.
don't feel it at
Uh-huh.
all. Like,
Exactly. So we
okay.
use the exact same needle for Botox. And we don't numb. We're typically not going to use any sort of a numbing cream or anything for Botox injections because it is very quick. It's average session. Let's say we're doing forehead, brow area, eyes, which is going to be typical. That's probably honestly going to maybe last just a few minutes of injecting, just a couple of minutes. It's very, very quick. So we're always going to, clean your skin off first with some sort of antiseptic solution. We draw up the products and the needles. we might make little tiny dots that we draw on your face or wherever we're injecting, so we know exactly where we're going to go. And then we do the injections. And afterwards, you might have little bumps. So you might have little tiny raised bumps that will last for a few hours. You might get bruising. If it gets injected close to a vessel, that can trigger some bruising. But for the most part, with Botox injections, it's very minimal, no downtime. You can go about your business. There are some restrictions as far as laying down flat and vigorous activity that we want to avoid afterwards, but you're going to look fine. Within probably a couple of hours, those little bumps I mentioned should be gone. Filler. Filler is a little bit more complicated. So with filler, we do numb. We are going to use a topical numbing cream most of the time, and we apply it to wherever we're planning on doing the injections. Now, with filler, there are different techniques for injecting. So you mentioned cannula. Cannula is one technique. Just using the needle directly is another technique. It really depends on the area that we're injecting that determines, are we using cannula or straight needle, and also the preference of the injector. Some people use cannula everywhere. They just prefer it. It is considered to be safer and a little bit more comfortable. Some people do prefer to use the needle, depends. So me personally, when I am doing lips, I don't use a cannula. I use a needle. I use the same needle though that I use for Botox. So I transfer it into those syringes and we do little injections there. And that just allows me to get a more precise shape, which for lips, is very important. For other parts though, cheeks, folds, chin, jawline, under eye, I use cannulas or the needle, either one. Kind of just depends on the patient. And we will numb sometimes. So with cannula, we actually will also inject a little bit of a numbing solution in the entry point. And so that allows you to not feel as much as when we insert the cannula. And for people who don't know, a cannula is just a blunt tipped needle. So when we're using a cannula technique, we do use a sharp needle first to make an entry point, a little tiny hole. And then from that one hole, we insert the cannula and then we can go in different directions. So it allows us to use one entry point and inject different areas. So that makes it safer. The cannula is not sharp, so less chance of puncturing a blood vessel, less bruising risk, things like that. After filler, you will have bruising though. No matter what we use, you will have some bruising and you will have swelling. And I would expect that to last for 1 to 2 weeks. So you don't want to do any sort of filler procedure before, you want to give it at least a month before any sort of important event. With the other things, PRF and Kybella, things like that, usually we're going to do some topical numbing if needed, or local numbing injections too. And I would say the swelling and bruising is probably the big thing that you want to be aware of after these procedures, except for the Botox. That's the one that's pretty minimal. But for all the other types of injections, you do want to plan for up to 2 weeks of that. How it feels, Botox is going to feel like little tiny pricks, little tiny pinpricks. It might feel a little bit sharp, but it's quick. That's the beauty of it, is that it's a very quick injection. Filler, it can be a little bit more uncomfortable. Now, I personally have not had filler done on myself, so I cannot speak firsthand on how it really feels. I can only go based on what patients tell me and seeing their reaction. So I can tell it is more uncomfortable. But I've never had a patient stop in the middle of the procedure because they couldn't take it. And I've had multiple repeat patients. So no matter what they felt, it was okay enough to come back and do it again. So can't be that bad.
It was worth it.
Probably a 3 out of
Right.
10 on
Yeah.
the pain scale.
For filler,
Yeah, maybe something like that.
maybe a 5. So I think it depends on the area. Lips, I can tell, are probably going to be the most painful area. So lips, I don't know. You have to ask somebody, but I'm sure they would probably say at least a 5. at least. Now, the other areas, cheeks, chin, jaw, under eye, probably not quite as high up there, but there's still some discomfort associated with it.
Okay. So you've mentioned quite a few products. I get the
Yes.
Easy Gel because that's your own DNA. So I get that. But okay, there's Restylane, there's
Mhm,
Juvéderm, there's
mhm,
Sculptra.
mhm.
How does one
Yeah,
decide what to
what to
use? Is
use.
there anything what's one better than the other, or what?
Right. Yeah, good question. So sometimes, well, so you mentioned Restylane and Juvéderm. Those are both brands. So it's just like Dysport and Botox. Same, for the most part, types of products, just different companies, different brand. They're hyaluronic acid fillers. As far as preference, I would say most injectors just have their brand that they like for certain areas. And there's honestly no rhyme or reason to it. Some people feel like, with lips, a certain one is softer and more natural, or with cheeks, another one gives more structure than others. So they have different consistencies. And that's what determines what filler we use where. So even if we're sticking within one brand, let's say we're using only Juvéderm fillers, within Juvéderm, there are multiple fillers. So there's a specific one for lips, a specific one for under eye, one for cheeks, jaw, folds. So you're going to pick the one based on the location of the body that you're going to inject that will work best. And what determines that is really the consistency of the filler. So, firm, gives a good structure versus things that are soft and more flexible. Now, Sculptra is a different product entirely. So, Sculptra is something that stimulates collagen. So, that is going to be also used in places where you're lacking volume. Very popular for people who lose weight, especially with the GLP-1s, and maybe their face is just looking thinner and they're noticing sagging in their cheeks because of all the weight they've lost. So something like Sculptra is a good option for them because it is going to, it's stimulating collagen, which will eventually lead to more fullness, more volume. Believe it or not, Sculptra was its first use. It was actually created for patients who had HIV, who got so skinny because of having HIV/AIDS. That was where it was first used. And then it eventually became used in the cosmetic industry. So that's what Sculptra is good for. And with Sculptra, you might also see stuff online of people getting it in other parts of their body, like their butt. So you might see things like liquid BBLs. They're using Sculptra for that. So
Yes.
it can be, yes, it can be,
Really?
yes, yes. Now, yep, it can be injected in the butt and in over time. It's not just a one-time thing. So you have to get multiple injections, but it can stimulate enough collagen to lead to a bigger butt size. And so sometimes people, they may not want to go under the knife for plastic surgery for that procedure, but they'll get Sculptra injections. Now, that's not something I offer in my practice, but there are a lot of people out there who do it.
Teaching me something new. I have seen the whole liquid BBL and didn't know. Wow. Okay.
Yeah, yeah, that's what they're talking about.
Yeah, Sculptra seems to be the new hot thing. But the thing with Sculptra, and you've mentioned it, that it's over time. So
Hmm.
I guess it takes time for that collagen to like
Hmm.
regenerate on your own. So
Yeah.
let's talk about time. How
Hmm.
long does it take for all of this to kick in and you start to see
Hmm.
results? It seems like
Hmm.
Sculptra is going to be a little bit longer
Hmm.
versus the Restylane or the
Filler.
Juvéderm. So
Right.
then why would I want to wait and do Sculptra versus something that could be
Hmm.
a little bit quicker?
Yeah, that's a good point. So with the hyaluronic acid fillers, you do see results pretty instantly. They do over time, they will collect water, volume, and get a little bit bigger over time, a little bit more swelling. But for the most part, when we do the injection, you're very swollen when we're done immediately on the day you're leaving the office. And then over about 2 weeks, the swelling goes down, and then you're going to see the final results, especially with lips. I would say that's definitely more prominent with lips, but also with the cheeks and other places too. So it's, yeah, within 2 weeks, you're seeing what you're going to see. And let's say it's not enough. Maybe you want more. You come back and then we inject more. And that's fine to do. You don't have to wait. We would say wait 2 weeks in between, but that's about it. With something like the PRF Easy Gel, which I mentioned, that one, you will also have swelling immediately after the procedure. Takes also about a week or so to go down. And then with that, you do have to get typically 3 procedures done to see the ultimate results that you're looking for. So if we're doing under eye with that one, we do it about 6 to 8 weeks later, it's going to kind of wear off and look like you didn't even have anything done. That's when it's time to come back. And then about 2 to 3 months after that second one, you're going to come back for a third procedure. So the whole thing can take a span of about 6 months when you're doing PRF Easy Gel. After you've done that initial series, then usually about once a year for maintenance. And then with Sculptra, similar, you're building, so you're gonna need several sessions to come in, get the injections, and for it to stimulate and do its thing before you finally get the results that you're looking for. So another injectable that we didn't talk about too much, but it is fairly popular, is Kybella. So Kybella, there's also something called lipodissolve. So these are kind of doing the opposite. These are dissolving fat, but very commonly we're going to use it in the chin, the chin area. People get concerned about having a double chin. And also we use it in parts of the body where you want to just kind of shape and slim down a little bit. We can use it behind your arms and your bra line area, stubborn pockets of belly fat. So, we inject it in these areas, and it actually works to dissolve the fat, and it's considered a permanent fat reduction procedure. With this one, same thing. You're usually going to have to do 2 to 3 sessions. Usually those sessions are going to be about a month apart. I would say on average about 4 weeks apart, maybe 6 weeks, and then you should see your results. So most of these procedures, besides Botox, and with Botox, timing for that, some of them are super quick where you might see results within a couple of days. Botox brand is the oldest and longest, and that takes 2 weeks to see your results. So yeah, we're looking at anywhere from days, weeks to months, between all of these different injectables. And why you would pick one over the other, I think it's just really your preference. So some people like the idea of, like with Sculptra, it's stimulating collagen, biostimulator. They just like that idea that it's stimulating,
The
their
real
body to do
thing.
something.
Yeah.
Exactly. PRF Easy Gel, all natural. Absolutely nothing man-made added in. So that's probably why some people might choose those versus filler, where it is an artificial man-made product, but your results are quicker.
I'm glad you talked about Kybella because I've always
Mm-hmm.
heard of it for that, little area
Mm-hmm.
underneath,
Mm-hmm.
but
Mm-hmm.
I didn't realize, again, you're teaching me something because I didn't realize that that's
Now,
what liquid lipo is. I thought it was like
yeah.
brand
Well,
new on the market because I'm hearing that and then something about lemon bottle and just all these
yes.
different names. So I'm trying to
Yeah.
research them, and Google
Yeah.
them, and it's not really telling me much.
No. And they're not all quite the same thing. So like that lemon thing is different. And to be honest, I don't know exactly what the active ingredient is in that. And that is not something I would really recommend. I don't think there's any sort of, there are not a lot of studies on it, no FDA approval, things like that. So I wouldn't do that lemon one. Now, lipodissolve is, so back to Kybella. Kybella is brand name, FDA approved only for double chin. Nowhere else, not FDA approved for anywhere else in body. People will do it for other places, but that is considered off-label. And then lipodissolve is similar as to Kybella as far as the active ingredient. There's just one difference with the ingredients. So that one is, it comes from a compounding pharmacy. So you can kind of look at it as, it's a compounded medication, so it's slightly different. Also not considered to be FDA approved. So if you are getting lipodissolve in different areas, it is an off-label procedure and something that, you should understand the risks and also go to somebody who is experienced with it. It doesn't mean, so things not being FDA approved doesn't mean that it's dangerous and you shouldn't do it. It just means though that there haven't been enough studies to prove its effectiveness, its safety for the FDA to make a formal approval of it. But it's being done, everywhere. Even Botox, like a lot of some of the Botox brands, they're only FDA approved for one specific area of injecting on your face. But you're not going to find anybody who's only going to inject just that one area. You're going to inject it, all the typical areas of the face. So the FDA approval thing can be a little tricky, and I would say if you have any questions, make sure that, ask your questions to whoever is doing your injections and make sure that they can adequately answer, to your satisfaction. And if you don't feel comfortable, go somewhere else because they should answer your questions.
So getting back to the easy gel, let's say you
Yeah.
decide to go with the easy gel. Okay, you're using your own blood. Okay, so
Mm-hmm.
walk us through the process. Where are you getting my blood from? How's that?
Yeah.
What are you doing? What are you going to do to me?
Okay. So we are drawing your blood from your arm. So typical place, if you are going to a lab to give blood, that inner arm area, that's where we draw the blood from. We're going to draw 2 tubes of blood. Once those 2 tubes of blood are drawn, then I'm going to take those tubes and start working on it. And you're just going to sit and wait. The whole process of prepping probably takes about 20 minutes or so. And what I'm doing with the tubes, so one tube, I'm keeping it cold. I put it in cold water. It stays cold so it doesn't start to coagulate. The other tube, I mix it right away. And mixing means I'm actually putting it in a centrifuge and spinning it down and separating the components of your blood sample. So when it's done, you're going to see a golden yellowish layer at the top and then the red blood cells at the bottom. The gold yellow layer at the top is what we want. That is the PRF layer. So that's the layer that contains the growth factors and all the things that we want to harvest and re-inject into your face. So I draw that layer out with a syringe and it gets put in another syringe and then I heat it up. And when we heat it, it turns into a solid. So it's a yellow solid, just looks like fat, looks like body fat. While that's going, then I take the other tube, do the same thing, spin it down, isolate the 2 layers, and draw out the yellow layer from that second tube. Once I have that second layer that's still a liquid, and the other one that has turned into a solid, I mix the 2 together. Once we mix them together, then it turns into a gel-like consistency. So it's almost a similar consistency to a man-made filler product. And that's what we use to inject. And you can inject it under eyes, your nasolabial folds, your lips, your jawline, anywhere that you want that structure. PRF can also be injected as a liquid. You don't have to do easy gel. So you skip the whole warming step and the solid step. You just draw it, you spin it, you isolate it. The liquid PRF can be injected in your hair, in your scalp for hair loss, hair thinning. Great for that. Also can be injected as a liquid into the face, and it can be microneedled into the face. We didn't talk about microneedling. It's not really an injectable, but microneedling is an amazing procedure also for skin rejuvenation, anti-aging. So you might have heard of a vampire facial. If you've heard of that, that's what they're referring to. Microneedling, PRF or PRP. PRP is just a slightly different version. microneedling that into your face.
Yes, we've seen celebrities do it, or more
Mm-hmm.
teams, but
Yes.
yes, we've seen that and called the vampire facial.
Yeah. 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 So, but yeah, that's really the process. So the whole thing doesn't take too long. And then once it's ready, then we inject usually with a cannula, if we're doing under eye, and injection takes, I would say, about maybe 30 minutes or so, depending on what all we're injecting.
And both the PRF and the Sculptra, both multiple sessions, right? You said 3 sessions and you start to see results over
Mm-hmm.
time. Okay, because
Mm-hmm.
those are the 2 that are more natural than the hyaluronic acid. So, do you prefer one over the other? Like, does it as an injector?
Um, like PRF and Sculptra and
Sculptra.
Hyaluronic. Yeah,
No, no, no,
I
no.
like
Like
PRF. Oh, Sculptra.
leaving the
Uh-huh.
hyaluronic. Like if you want the
Oh, okay.
natural,
Yeah,
building
so
your own
Sculptra,
collagen.
yes, Sculptra is actually it is different. It's very different. It's not, we don't use it for the same things that we use PRF for. Yes. And Sculptra is, I wouldn't say it's entirely natural because it is an artificial man-made product that we are injecting into the skin. It's just that what that is doing is triggering. It also will help to trigger your body to produce collagen, but it's still something artificial that's being injected in versus PRF. What PRF is a, your own blood sample and your own growth factors that we isolate out, concentrate, inject it back in, and then that is going to stimulate the regeneration. So it is slightly different. Um, at PRF all the way, I would, prefer, just because of how natural it is, and it's just such a low risk procedure. There's no risk of your body rejecting. There's really no risk of occlusions. With Sculpture, you still do have some of those kind of risks.
Yeah, you mentioned the natural look because that's the key. No one wants to look done.
Mm-hmm.
So it sounds like you're saying the Easy Gel makes you look a little bit more natural than the others.
Not necessarily. No
Okay.
matter what you use, it depends on the injector, is what I would say. How much they're injecting and where they're injecting. Because you can have a hyaluronic acid filler injected in multiple areas of your face, but just done in a strategic way and in quantities that look very natural, that nobody really has to know that you had something done unless you tell them. So I think that is more so what determines that natural look, is how much you get injected and where.
Okay.
Mm-hmm.
So let's ask the $64 million question, or how much does all of this cost? Because you said no insurance, and I get that. So like people need to
Mm-hmm.
know, like, is it going to be
Mm-hmm.
cheaper to get Easy Gel versus Restylane
Right.
versus like where are we? Just ballpark.
Yeah. Okay. So let's start with the Botox, the neurotoxins. Those are usually going to be, there's different ways to price it. So some people will price by area. They just have their own price for doing cheeks, a price for chin, a price for under eye. Other places will charge by the unit. So I would say in the Houston market, price per unit is probably going to range from 12 to $17 on average per unit.
Per
How
unit.
many units are you going to need for a full face? Anywhere from 30 to 50 units. So you can do the math. So low end, 30 times 12. That's going to be a low end for neurotoxin. For filler, it also depends on what type of filler we're using. So the different types have different costs. Lip filler typically is going to be anywhere from $700 to $800 for one syringe. Some people, if you want a really natural result, probably just start off with half of a syringe. Half of a syringe, $300 to $400 is what you're looking at. Cheeks, chin, those are going to be a lot higher, you know. So again, probably it's very hard to give cost for those because everyone is different and with the amounts that they're going to need. But on average, you're probably looking at anywhere from maybe $1,500 to $4,000 for full phase filler. That's going to really, you know, help with the structure and all the things you're looking at. For PRF, that I would say that honestly varies widely. So people charge different things. In my practice, one session is $650. And we do have some package discounts for people who are doing like the package of 3. And what else?
So if you just want
Uh-huh.
like the under eye area for the
Yeah.
PRF, that would
Yeah.
be, is that
So
two units, one for each eye, or how does that work?
no, it's that one session. That's
Session.
price for a session. Yep. And so there might be leftover if you're only doing under eye. You might have some leftover that you can inject in other places. So, you know, we can inject it in your fold so it doesn't go to waste. So usually, you know, you're going to have enough to do a little bit in multiple areas of your face if you're doing PRF. But no matter, you know, if you're doing just under eye, doing folds, you're still going to want to do, you know, ideally about 3 sessions of that. Sculptra, again, also huge variance. I would say anywhere from maybe 700 to 1,000 per vial, and then it depends on what part of your body you're doing. You might need 2 vials, you might need 4 vials, we might need 2 to 3 sessions, we might need 6 sessions. So, you know, you're looking at several $1,000s for most of these things. You know, low end Botox is probably going to be on the lowest end, and it doesn't last as long, you know, as these other things. But that's why it's so popular, because it's like an entry treatment. It's temporary, but it can solve a lot of issues that people are concerned about in their face and a few other areas as well. Filler is going to be a little bit more of an investment. Filler, Sculptra, PRF, Easy Gel, you're looking at a couple $1,000s at least, typically.
Which is, you know, what women, especially Black women, will spend on their hair and nails over a year, you
Yeah,
know.
yeah,
So
that's true.
it's all comparable,
Yeah, yeah.
in my opinion.
It is. It is. So it depends on, you know, what's important to you, you know? So if, like I was saying, if your appearance and the anti-aging and that's one of the most important things to you, then you know that, okay, maybe, you know, you put aside some money a little bit each month and save up for your procedures so that you can get it done. We also have memberships. A lot of places do that as well. So you're paying monthly, and then it can go towards a procedure each month. With ours, it does roll over for a few months. So it's almost like you're banking, and then you get a discount on the procedures as well.
And that's the only option, the memberships? Are there no payment plans through any?
No, there's payment plans as well. Yeah,
Okay,
yeah.
tell people about that.
Yes, there are several, you know, popular ones out there like Cherry and Care Credit. You know, we do accept all of those kind of things. Just in our practice, we'll work things out with patients all the time, pay a deposit, you know, maybe first procedure, you're paying a certain amount, second time you come in, you pay the rest. So, you know, we love to work with our patients because I get it. It's expensive. It's a big investment. So we're happy to work with you.
I do have one last question for you. So, you know, me living here in Houston, I see all of the different places. You see the Instagrams. We know what's going on. Dr. Anyaoku, what sets you apart, besides you being a board certified physician and all? your practice, what makes you different from all of these maybe like pop-up places? Because you almost see them in every little plaza now. You can pass like a little strip plaza, you see these places popping up. It's become
Hmm.
very popular to go to
Yeah,
those. But
it is.
what
Yeah.
makes you different? Um, and,
Yeah.
and with that question too, how do you continue your education to where you know about all of these new trends that are coming and these new products that are coming out?
So, as far as what sets my practice apart, as you mentioned, one of the biggest things is the fact that I am a board certified physician, an MD. So, nothing against, other medical professionals, but there is a difference. A physician went to college for 4 years, medical school for 4 years, and then residency on top of that for a minimum of 3 years. So that's way more than some of these other people have done. And here in Texas, you actually have to be very careful because anybody can inject Botox. You don't even have to be a medical professional. You don't have to be a nurse. You don't have to be anyone. Does not matter your background. You can take a course, get a certificate, and you can start injecting. You have to find a medical director who will sign their name to you ordering products and things like that. But you have to be extremely careful because a lot of these places out there might be people who really don't have much, if any, clinical training. So there's the number of years of training, and with that comes knowing the anatomy of the body, of the face. I know where the underlying vessels are, the nerves, the things like that. These are things that we spend time learning in detail and that play a role when someone is injecting your face. So you want to make sure that the person that you're seeing has that knowledge. I also strive for natural results. So and for me, yes, this is a practice, this is a business, but more so than a business, I want my patients to be happy, to come back, and to refer their friends. So I am not here to make money. I'm here to provide good care. I have patients that come to me and ask for things, and I tell them, no, I don't think that's ideal for you. I have turned down procedures, turned away money because it's just not the right thing for the patient. Also, with having that medical knowledge, some people might have some underlying conditions that can make it dangerous for them to get certain injections and procedures. And I, I know enough to ask and to look for those things. Other places you might go to, maybe you have some sort of autoimmune condition. They shouldn't be doing certain things on you. They're not going to know that. They didn't go to medical school. They're probably not going to know that. So a lot of these places are really just, they want to make money. They're out to get your money. They want to sell. They're going to try to sell all kinds of things. When patients come here, they love that they're not being sold to. It's just we come, they come, we consult, we discuss, talk about the recommendations, and then honestly, it's up to them. It's up to them. There's no pushiness. And I like to work with my patients as far as building, with especially with filler, you don't necessarily have to do 4 syringes at the same time. You can start off with 2 and slowly build. So, and especially for people who are scared of looking unnatural, which is probably the most common thing that I hear. They come to me and they're saying, well, I want this, but I don't want I don't want to look fake. I don't want to look done. I don't want people to know that I did this. So I have developed the skills and the expertise to give people subtle, natural looking results. And so when you come to Hibiscus Aesthetics for your injections, that's what you're going to get. You're going to get a physician who will listen to you, take all of your considerations and your desires in mind, and help build a plan for you that is going to give you beautiful results that you're going to love and you'll eventually want to come back and redo once it wears off. and you feel comfortable. So the final thing I will say that sets me apart is that I love to explain to my patients what is going to be done, how it's going to feel, why we're doing it, how many I mean, I can't even tell you the people that have come from other places, they don't know they don't know what products was injected into their face. They don't know how many units they got. They don't know anything about it. They just sat there and just let somebody inject them with anything. My patients know exactly what product is being used, how many units is being used, and why. So I do a lot of explaining and educating with my patients. Now, to answer the continuing education piece, um, that's, as a physician, that's just part of what we do. Like, we are constantly learning, seeking out courses, journals, reading, just keeping up on the latest trends. So those are all things that I do. Um, Aesthetics courses, conferences. Um, there's several journals that are in the industry that I get on a regular basis. So, all different ways, learning from colleagues. There's a network of us, physicians, who are in this industry, and we learn from each other. We communicate and learn from each other. So, staying on top of the latest is very important. Social media is a good way to hear about things that are out there, but then, once you start hearing about them, then you have to do your own research and, really learn, okay, is this something that is worth bringing into the practice? Is it safe? How long has it been used? What studies have been done on it? So these are all the things that I think about.
And so, how can people reach you if they want to use your services?
Yeah, so our website is www.hibiscus.health. Well, it's not .com. So hibiscus, HIBISCUS.HEALTH. I'm on all of the social media platforms. So Instagram and Facebook, the practice handles are Hibiscus Aesthetics and Wellness, all spelled out, all one word. TikTok, it's under Dr. Jacinta MD. I also have a TikTok under that name as well, a YouTube page under that name also. But from the website, you can find links to all of the different ways to get in touch with us, as well as send an email to the practice. So, and you can give us a call. Our office number is 281-394-4959. I'm here in Katy, not too far off of I-10, and love seeing new patients and just having a consult just to talk about your needs. So there's no pressure to get anything done. We're happy to just, sit and talk and see where you're at.
I love that you're on TikTok. That's where you can really show off what you do.
Oh, yeah.
Well,
It's
that's
fun.
great. Well, thank
Yeah.
you so much for joining us today. Boy, did I learn a lot.
Yeah.
I might have to make the drive down to see you. I'm in the Dallas area.
Oh,
So,
yeah.
but that's
Well,
okay. That's okay.
yes.
I may have to make the drive
Come on down.
to
Be
get
happy to
the
see
the
you.
under eye area and
Yeah.
the folds.
Yes. Yes.
So,
Well, thanks for
thanks.
having me. This was fun. I love sharing and educating people about this topic. So this was great.
Well, I hope that in the future you'll come back to us because your
Yeah.
practice, you have so much. This
Mm-hmm.
particular episode, we really wanted to discuss injectables, but
Mm-hmm.
you have so much that you all do, like getting
Mm-hmm.
into the whole facials and um,
Mm-hmm. Mm-hmm.
laser hair removal, because I have so
Yeah.
about that, especially with deeper skin. So,
Yes.
I
Yeah.
really hope that in the future, maybe in the fall, that you will
Yeah.
come back and talk to us
Yeah.
again.
Absolutely. I would love to. The weight loss is also a hot topic, and I love talking about that as well. The GLP-1s, very controversial, but that's one of the favorite topics of mine. So whatever you guys think of that you want me to talk about, I would be happy to come back and
Look,
discuss.
Sanji's ears just went up like a little
Yeah,
rabbit.
because like I said, I've lost 70 pounds on tirzepatide. So, and
Yeah, yeah.
our second show or our third show, I think, was on
Mhm.
my journey with the
Oh,
GLP-1.
wow.
So that's like a
Awesome.
really big thing for me.
Yeah.
But one of the things that KG and I have been discussing a lot is the liquid lipo, because with the GLP-1, while
Yeah.
I have lost all the weight and everything smaller,
Mhm.
the belly won't budge. And part
Yeah.
of that has to do with menopause and,
Yeah.
some
Yeah.
other things. So we've talked
Yeah.
about the liquid lipo, so we'd love to hear more
Mhm.
about that
Okay.
one
Yeah,
day.
definitely.
Okay, well, thanks again.
Thank you. All
Thank you.
right.
So, Sanji, this was really an awesome experience to be able to actually hear from Dr. Nyoku about injectables and understand the different types and their real names and versus just brand and what the product actually is. What I love about her is she's an educator. And again, that's just something that I'm really big on, education and someone explaining everything to us. So I absolutely love her. And I love that she's close to me.
Yeah, that's a big plus. I wish she were close to me too. Yeah, no, I just love the fact that she just broke everything down and explained it in a way that a child could understand, because there's a lot of fear involved. There's a lot of uncertainty involved. And then there's the stigma, the shame, all this, there's so much. But she really broke it down in a way that, you can feel good about it. And I like the fact that I got to learn about different brands, what's used where, how it's done, that all matters. That all matters, because when you're touching somebody's face or you're going into somebody's face, there's a lot of questions. And she was really good at answering them in a way that really made me feel comfortable about, possibly doing this sometime down the road.
Yeah, even the way that she made us understand the needles, that's something that I didn't know and didn't even think about. But for her to explain the different, needle types that are going in the skin, that was just like for me, it's that mind blowing education where, wow, that's not even something that I thought about. Or telling us that, certain products shouldn't go in certain places. And I think the biggest takeaway for me is, we're both here in Texas, you're in Dallas, I'm in Houston. I'm really more so in her market. And for her to say that here in Texas, anyone can inject, that's scary. So you
Very
need to
scary.
do your homework. Again, one of the things I love about Dr. Jacinta, she is board certified. She's board certified in family medicine. This is something that's important. And just listening to her describe the whole going to medical school and doing the residency and having all of that 7 years under her belt, that's important. And again, she knows the face, she knows the muscles, she knows what's going on. So that's important when you think about it.
Yeah, you and I have talked about med spas in the past, about, people going to med spas for various things, not just for a massage, but to get the weight loss medications and as well as injectables. But like she said, the person who's injecting you could be somebody like me who just took a class and passed, and somebody saying you're hired. See, that's scary to me. No. I want someone who, if something goes wrong, they know what to do. Or better yet, they minimize the likelihood that something can go wrong because they're really skilled in what they do, because they're a doctor. It's almost like going in for a surgery. Would you want someone who's not a board certified surgeon to do surgery on you? No. Same thing when someone's going into your face. It's invasive. You want someone who knows what they're doing, and someone who, like her, who's a doctor. And I get it that not all of the locations and places where you can go to get this done have doctors. Some of them have nurses, nurse practitioners, and PAs, and they're fully qualified. But I love the fact that she's a doctor. That makes a huge difference.
And I even love the fact that she talked about preventive medicine. I would not think to get Botox in my 20s. But again, we're living in a different time. If I talk to my mom right now about Botox or, different neurotoxins and fillers, my mom would just say, please, Karen, you don't need, just put some skincare on, just do what you're doing. She wouldn't really want to have that conversation. And it's not because she's just totally against it, but she would just feel like you don't need that. Versus now, you have this younger generation coming up and they're saying, hey, I want to look my best. I want to start preventing things now. So it kind of opened my eyes to where I wouldn't have thought someone in their 20s would need any type of neurotoxins. But, you know, she made it make sense with saying it's preventive, starting off with baby talks, just little
Baby
baby
talks.
steps and not that much of it. And I love that she believes in staying natural. You don't
Yeah.
have to look like you've had work done.
Nobody wants to look like that. You just don't. Especially in our age group, because you know what a 40-year-old should look like, what a 50-year-old should look like, 60-year-old, 70-year-old. So then if you have a 60-year-old who looks like a 30-year-old, it's like they must have had some work done. That's kind of like the automatic thinking. But I also like the baby talks as well, because boy, if to do it early, then so it sounds like, so this new generation, these Gen Zs, by the time they get to 60, they're not going to look like they're 60. They're or what our generation of 60 should look like, because if they're taking the preventative steps, then good for them. I'm happy for them. Thrilled.
Absolutely.
We hope you found our conversation as insightful and thought-provoking as we did. If you enjoyed the show, please like and subscribe.
Absolutely. Please make sure that you check out our website. It is girlieladies.com. There you can also go into our contributor area and take a look at our guests that we've had. You can read about them and see their different accounts and social media, websites. And then please make sure that you follow us on Instagram. We are at Girlie Ladies. And also, I have my own Instagram at the KJB Effect.
And you can find me on Instagram at Digital with Sanji, and on Facebook and on TikTok and other social media platforms. You can find me at Sanji Cosby. I would love to hear from you. So, in the meantime, keep exploring, keep questioning, and most of all, keep growing. Thank you, everyone.